growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, I am Dr. Steve Rasner, and you're tuned in to The Lionhearted Dentist. So our journey continues. And as you know, in the last several weeks, several months, I've altered the theme of what we'll discuss each week. Those of you that are tuning in for the first time, or you haven't tuned in a while, you know, my agenda is one agenda: to make your practice as productive and rewarding as it possibly can be. And when I say your practice, if it's going to emulate anything I've created over the past 40 years, it would be a fee-for-service practice, either non-insurance or very low insurance dependency. And you need to know that when I look you in the eye, like I'm doing right now, this is real. Why else would I do this? Why else would I lay out for you a blueprint to follow that? It doesn't require a lot of money. It does require a lot of work and a lot of diligence and vigilance. You know, making sure that the things that you espouse to your team are actually enacted by that team. That's not an automatic for any of us. So there's so many components that go into this way of practicing. And I got to tell you something. I don't know that everybody gets it. When I say that, I mean your patients. Now, I don't know if my patients really understand the value of the extra time we take to create laser accurate margins on their full coverage crowns, or me paying more money for the lab work I use, because that is the standard that I'm comfortable with and I've used for all these years, and I'm sure many of you use. Does everybody get that? I don't know. And so that brings me to part of the reason to follow the Lionhearted Dentist philosophy is for personal self-fulfillment. There's no doubt about that I have tons of colleagues that way outproduce and outnet my experiences as a dentist in terms of money. But at the end of the day, for me, and I think for many of you who've gotten to know me either through a live lecture, maybe through these podcasts, to me there's great reward in the self-accomplishment of, you know, I had a guy come in yesterday, as you do. A patient came in to get a clearance because he's having a knee replaced in 3 weeks, and I hadn't seen him in a while. And so when I walked into the operatory, his x-rays were up, and he had extensive crown and bridge, no implants, throughout his mouth. And I didn't remember treating him. And I was pretty impressed with what I was looking at. Happy to add to the story that I realized I did the work some years ago. So to me, it doesn't bring us any more financial reward when we have a satisfying accomplishment that we've created clinically that's lasted years and years. And trust me, I have many other stories that I'm sure I gave it my absolute best that didn't turn out as well as this patient's work did. But that's what you're tuned into. And honestly, you know, there certainly is substantial financial reward in this model I provide for you as well. Okay? So just so you know where we're at, thank you to all the listeners I have, and all the people that tune in around really the globe to hear me sit down with you weekly and talk shop. And I try to respond when we speak on these weekly podcasts about some of the emails I've gotten and what's, you know, on your mind. But I know what's always on your mind is what's on my mind. Like, I'm going into work on Monday. I have a 4-day week coming up. What kind of week am I going to have? Is it going to be fulfilling? You know, I started last Monday, and I know you get this. I started out with somebody texting me 7 o'clock in the morning telling me that their son had a fever, that he had been quarantined for 2 weeks, and they wanted to know what to do with regards to COVID-19 and protocols in place. And, we've talked about all that before, but as we get into practice for several months, I'm sure some of you have encountered that type of scenario, and you got to stick to your guns. The guns are, if there's any suspicion that there's a reason for that staff member to feel that they may be a threat to the staff, to the patients that you work on, it shouldn't take you but a nanosecond to understand they can't come in. They got to get tested, and that's just the way it is. And hopefully, in upcoming weeks and months, we'll have available quick outcome tests where we know the results in minutes. I know they exist now. There's just not abundant places to have those done. And I'm sure that's what's going to happen. But in the meantime, I start out my Monday down an assistant, right? And I'm sure that happens to many of you. That's the world that we live in, and it always seems to happen on a Monday, doesn't it? And while we're talking about, what's trending in my practice, which I believe seems to be a barometer for many of you, we continue to be off about 7%, which isn't terrible. What is a little strange for me is I can have a great week, like a 6-figure collection week like I did 2 weeks ago, followed by a not so great week of much less than that, significantly less than that. And somehow when we average it all out, it tends to be what I just alluded to, 7 to 10%. So that's where I seem to be. It's 7% where I seem to be. I don't even know if I mind, as long as the bills get paid and I can take my paycheck. And I don't know if I care that we're doing less. I've kind of gotten used to it. It's kind of a silver lining of this whole thing. But let's get to the meat and potatoes of this week's podcast. And there's several items I want to cover. But why? Why didn't I have such a great week right after I had an amazing week? And the answer was simple. I didn't have a lot of new patients that week. I didn't even have a lot of targets to go after. And when I say it like that, I don't mean to be callous or totally business. You don't have patients that need anything. You don't have a quantity of new patients calling in a given week. Where does the new production come from, right? So what did I do about it? Now, I've been in business for 40 years. And probably some of you listening, and I know many of you listen to me, that have been in business as long as myself, maybe you wouldn't do anything. I mean, I just got done telling you I didn't mind working a little less, which was, put on me by the protocols that we had to implement because of the COVID crises. But not me. I just never can relax if I detect even the slightest trend. If you care and you want to stay busy in dentistry, it's not a bad way to be. So I've been looking, what would be the first thing you would look at if you weren't getting enough new patients? And, you look at your marketing, which is exactly what I've done. And I've been trying things that I hadn't done before. So forgive me if it's a little bit redundant, but I have found radio in smaller markets to be a very effective way to communicate your personality to the listening public. There's no doubt about that it's my number one source of return to my practice. Now, how do you do that? What do you do? I have personally found that the best patient supply line comes from those that listen to oldies, that enjoy the 60s music and the 70s music, etc. I don't know. I haven't experimented with rock stations or rap stations or things like that. But if you think about it with the baby boomers and all that, it makes some sense that that's a good market for you to focus on. So I'll put it out there again. My email is my name, Dr. Rasner, DrRasner at AOL. And if you want, I can send you one or two of the actual radio commercials I've created, and it's me speaking for 60 seconds. You want to try to get a deal like I've gotten in the last several years. And I'm on the radio 25 times a week for 1 minute each. I sponsor the weather, and it costs me about $900 per month. And it's 5 times a day. You see the beauty of this? What we're doing right now? That's what I mean by talking over a cup of coffee or a beer or whatever. Because don't you want to know like what you should spend? I'm the guy that spent $20,000 in ESPN in Philadelphia and got one patient from it. The contract was for, I think, 6 weeks, and I was on twice a day. Don't do that. That's real money. It's gone. I'll never get that back. I didn't have anybody to bounce the idea off of. You do. Me. So I would explore that avenue. And I've told you about an upscale magazine that does a very nice job. And that has been a pretty strong source for 2 years. But I'm looking at these things because I'm not sitting back. Because what happens to me is I worry, is this an impact from COVID? I'll tell you some other things I'm doing. I am continuing to work harder to spread the goodwill that I think my practice focuses on every day. This is easy stuff, but listen to me for a minute. You know how when you're jammed, you're going through that time of year where you almost dread your hygienist coming to you to tell you that it's a recall exam due right now because you're so busy in what you're doing. And so you go in and you go through the motions. I mean, it's something I've done for years and years. With the extra time I have, with seeing fewer patients from the pandemic protocols that we put in place, I'm really spending, it happened naturally, to be honest with you, but I like it. I am really reconnecting with all my patients when I go into the recall room, to the point that I'm running behind when I'm doing it. I don't just walk in like I often did in the past and say things like, oh, how you doing? Or maybe I didn't even ask. Like it was such a perfunctory, automated, like I blink sentence, how you doing? I didn't even know how they were doing because I wasn't waiting to hear out. But I'm actually sitting in the clinician chair looking at them like my arms crossed, like I'm looking at you right now. Say, so tell me, I haven't seen you since this started. How you making out? What's going on in your life? And I take the time to hear them and listen. And I also let them know that I'm deliberately hoping I say this. So let me take a look at your mouth. I hope you don't have anything for me to do. I know you have a lot on your plate. Now listen, I'll say that often knowing that they already have an issue. But I want them to feel, and I want your patients to feel, no desperation. Because a lot of them, I believe, think that we're all struggling. And maybe many of you are. I don't want them to feel that. I want them to let their guard down, because they can. Because what I'm telling you, that I tell them, is the truth. I'm going to look at your mouth, and because a filling may look old and maybe a little cracked, I'm not going after every single restoration that we probably would do eventually in their career. And I know that may be counterintuitive to the comprehensive exam that you hear me promote all the time, and you should adopt that if nothing else. And I really have to wonder out loud how many of you are really doing that. If you ask me, the biggest single factor that accounts for me staying busy, there's about 3, but one of the 3 cornerstones would be that I do the comprehensive exam. That I don't ever just look at a patient at the problem they came in for, if it's a broken tooth, if it's pain on the lower right. And I've been over this ad nauseum with you, but I really believe in my heart that many of you don't execute that way. And if you go back to the early podcast, I have to say I think they're clear. I think they're well done to show you how you can do that without being overbearing, without being threatening to the patient. No patient wants to hear you're going to do a comprehensive exam. It sounds expensive, just the words. The truth is, it's the only way you can give them sage advice on what to do with their mouth. And every patient understands that if you explain it that way. And that's all been covered over and over again. I feel like I can never cover it enough. Okay? And if you do that, if you look at the 5 areas of their mouth, no matter why they presented to, if they don't like their smile, they broke a tooth, they have pain, a food trap on the upper right, whatever it is, I'm looking in this order, and I tell them, at the health of their soft tissue. And I could spend, and I have, an entire podcast on why I start there. And you know the reason why. You already know that. And I tell the patient that. I said, why would I look at your gums first? You didn't come in here complaining about your gums, because it's the gateway to health to the rest of your body. Without a healthy periodontium, and I'll actually say periodontium to a patient, meaning your soft tissue, your gums, I'll elaborate like that. Without that, then anything else I do on you is going to be compromised. And the problem is soft tissue disease often doesn't hurt. So you don't even know there's an issue. Yeah, your gums may bleed to you once in a while. You don't know that it's an actual disease process. And my bar is extremely high for you because I think it should be in that kind of order. And then I know you've heard all this, I'm not going to do it all right now, but then I look at their entire dentition and I explain why. And then I'll look at their occlusion, or how their teeth come together is how I'll talk to them and make sure that's not an issue. And then I'll look at their missing teeth and is that related in any way? And if it's not, we don't have to deal with that. And that's how I talk to them. Do you get me how I'm doing this? Do you see how compelling it is? Or how easy it is for patients to get that. They get it. And then I purposely say, and the last thing I'm going to look at is your aesthetics, your smile. And that's always an up to you thing, not me. But I had a patient in the chair just yesterday. And you know that one of the things I've been doing lately with you is my case presentation of the week. And that just means I choose an interesting patient that developed into either case acceptance or didn't, to try to get you to understand even more my approach, which I think would help you get more case acceptance. And you heard me just mention that the fourth thing I talk about is their occlusion. And is that an issue or not an issue? Let me tell you this case presentation story, because it is very interesting and it's relevant to that. So this patient had been in one of my courses, an extraction course patient course I give in my office. And you have to understand that they are geared towards people who have the most financial need. Why else would we do it for free? Because it doesn't cost the patients to have their teeth removed. So when I saw the patient in my schedule, and next to her name was, because I have an upcoming extraction course, her name was there. So I walk in the room, and I don't remember all the patients. I didn't clearly remember her. Pleasant looking, 58-year-old, was missing posterior molars. And I said to her, so what teeth were you thinking of having removed? Because I was a little confused, because on the x-ray I didn't see any teeth. I hadn't looked in her mouth yet. She goes, oh, I'm not here to have any teeth removed. I'm here to see if you can do anything about these front 4 teeth that have worn down. It seems even more to me since you removed the molars. And indeed, it was 7 through 10, very worn down, and other teeth worn down as well. And so the interesting story is this: you never know, right? I mean, you just never know. I wanted to say at that moment, well, then why did you go to my extraction course for free? If you're even thinking, I said, when I treat patients privately, it costs. It's not like the extraction course. She goes, oh, I know. I said, okay. So let me explain to you what would be involved here. And I examined her, and what I realized is because of her collapsed VDO, vertical dimension of occlusion, there's no way I could treat. And the front 4 teeth were significantly unesthetic, significantly worn down as a result to a closed vertical dimension of occlusion, of which I could treat by opening and dressing several teeth. So the problem is, it wasn't just a 4-tooth treatment plan. It involved many, many teeth. Now, by the way, when I address patients like this clinically, if it's like a virgin tooth and I have to open up their vertical, if I can hold that with composite as opposed to an onlay or a crown, then I do that. And I've done that very successfully and I'm sure many of you have too, for a long period of time. And I went into really detailed explanation of why we needed what to do. And you hear me all the time talk about trying to get case acceptance and completion of that, in other words, a financial commitment, the first time they come in, if I am very comfortable with my treatment plan, which often I can't do that the first day because I have to maybe wax up models for the case I just described to you, or I have to review a CT scan. And so I don't want you to think it's 100% of the time, but it is a significant percent of the time that if I know the treatment plan cold on day one, the first time they've come into the office, we will, if they have the time, we will present that treatment plan that day. But I didn't do that on this case because as I sensed where this treatment plan was going, I said, listen, when you make these kind of decisions, a financial decision, do you make them on your own? Because I have all kinds of patients that come here over 40 years, and some of you are completely independent of your spouse, and some of you make all your decisions together. Which one is it for you? She goes, oh, me and my husband sit down for everything we're going to invest in, whether it's something in the yard or house or my teeth. So we did not present that. It couldn't have been any clearer to me. So I said, well, let us put together a couple options for you while you're gone, and let's find a time when you and your husband can come together, which they did, by the way, 3 days later, and I had a fairly significant treatment plan, north of $10,000, north of more than that. I don't think it's relevant to tell you exactly how much. I think what is relevant, if you looked at these two people, you would have never guessed. I'm being honest. Just by the way they're dressed, you can't judge by that. By the fact that they were in a course of mine that was dedicated primarily to people that financially needed it. She really made it clear that not having a smile anymore was impairing her life. And I got to tell you, it's part of the whole vision I give you. So I would tell you that falls under the category of doing the right thing for people. I didn't assume that she could, because one of the options could have been extracting those 4 teeth and a partial denture. And that was described to her visually with a partial denture, but I'm talking about a 58-year-old who's never worn a removable appliance, which I always go into that scenario, that visual scenario, when I'm taking a patient who may go from never wearing a prosthesis to wearing one. I want them to touch and feel and see it. This is not complicated stuff, guys. And I got to tell you, even though it wasn't a great week, that was part of that not so great week, or I'd have had a really not great week. And while we're on that, if I was like everybody else and I counted production that I really believe was coming in, it would have been a great week. I have a patient that's coming 3 weeks from now that's paying us in 3 weeks. And when you hear me say that, and I put it to you like that, you can be sure they will show up. And I'll give you that treatment plan in the next podcast because it is very interesting as to why sometimes I'm guided by what I do. But I can tell you this. It always goes back to having clinical skills rock solid in your back pocket that you have to own if you're going to follow the guidelines I lay out. If you refer everything out, naturally you're not going to have a multi-million-dollar practice. And I don't know how important that number is for you to achieve, but certainly a lot of my success is that I'm very comfortable with a wide range of skill sets. That being said, I don't do any ortho. I don't do any molar endo. I don't sometimes even do anterior endo if it looks tricky to me or it's a retreatment. And I know that many of you watching are very, very good at this, or third molar extractions. And I certainly am qualified at being very good at doing those. The return on investment for third molar extractions, it's just not worth it to me. And I want you to know something as we close this podcast. You're going to find your niche. If you are diligent to following my podcast, other thought leaders' podcast, taking courses on a consistent level, and above all, really from your heart, treat your patients correctly. I mean that. That's not me talking to you because I don't need to be ultra productive or successful anymore. I go for being as successful and productive as I can be given the amount of hours I'm in my office, but not at the expense of having people treatment plan for things they don't really want, they don't understand, that they're in crises for because the money is too much, but they said yeah because you have this shark of a closer in your office. I don't want them to do treatment that they're stressed out over doing. I'd rather them not do the case. I'm not kidding. So you'll find your niche if you follow this. Trust me, it's there. So listen to me. You might be struggling right now. I don't know. But this is not pie in the sky thoughts. This works. And part of an discussed protocol is doing the right thing by your patients, is going in and treatment planning them if you can. Sometimes you can't. By that, you have a patient that has a atrophic mandible and they're wearing dentures and they can't afford an implant retained denture. And so sometimes you can't treatment plan them and come up with a compromised, acceptable plan. That is part of being ethical, quite honestly. Being willing to turn down any business because for that one patient, the only thing that would work and substantially improve their current clinical situation is just not affordable. But I want you to know that this is not unique to me. You can have it no matter where you're located. I don't care what country you're in. I don't care part of the United States that you're practicing in. You can have this level of success, or certainly some level of this success, depending on what your desires are. You know, I've always said, you could do half of what I do and have a great professional and personal life. I truly believe that. So, again, I know my podcast is probably not for everybody. There's podcasts out there that teach you how to prep teeth in 30 seconds. That's not my interest. Or other things that are strictly driven to the bottom line. And I'm telling you, this podcast, to me, is about, I would hope it is, about ultimate fulfillment. So thanks for tuning in. Hoping you have a great week. And I'll see you next time on The Lionhearted Dentist.